Good afternoon. So had some interesting things go on in the clinic this week, and figured I'd share some of this. So last week we had a patient come in diagnosed with chronic Lyme disease. He is displaying symptoms of extreme joint pain, brain fog. He's having gynecomastia, and he's retaining water all over his body. He has looks like systemic edema. Sides have saddlebags on them filled with water. Pretty extreme case, actually. And I've worked on this gentleman before, and he used to be a power lifter, and he was a pretty in shape guy, soccer player, artist, dynamic individual, and he's completely ravaged by this bout of Lyme disease. So anyway, I gave him some acupuncture, and I advised him to do an infrared sauna every day, because he actually has one in his house. And I put him on a ketogenic diet. And a week later, he returned to the clinic. And let me tell you, all of it worked. He is experiencing much less joint pain, although it's still there. But it's way better, way more manageable for him. And his saddlebags are gone. He's totally less damp. We basically turned him into a peeing machine. So he pissed out a lot of that water, and his cognitive ability is improved by leaps and bounds, and he's on board. He's got hope. The doctors put him on all kinds of antibiotics and steroids. He was on doxycycline. He was on tamoxifen, which is a breast cancer drug. And none of it worked. It actually just made him worse. And he's doing his infrared sauna every day, and we also gave him some classical pearls, Heiner Fruhoff's line. I gave him lightning pearls, and things are looking up for this gentleman, and we're going to continue that process. I tested his ketones, and he wasn't quite in ketosis yet, but he had eliminated carbohydrates from his diet for about 5 days now. So when you do that, actually, it's the process is a diuretic process. So again, he basically pissed out all his damp, and we're well on the way to healing him. So I'll let you know how this case goes more in the future, and kind of interesting to me, and pretty interesting how even without too much of the herbal medical theory, even though we did give him herbs, I don't think that's what did it. Everything happened with him endogenously. Endogenously means he produced the herbs in his own body. And if you know about ketones, they pass the blood-brain barrier. So it's a very interesting therapy for many different reasons. It's a therapeutic way of eating. So anyway, leave me a comment, and I hope this was informative to practitioners and potential patients, as anybody who you know in your life that has Lyme disease. Send me a message. I can help you out with some of my expertise. I've had some experience with it. Okay, thanks a lot.